I'm Dr. Sandeep Kaushal, working as a cardiologist in this medical field. I have experience of more than 12 years in the field of cardiology. I'm doing interventions as well as clinical work also. So this is my whole profile, and basically I'm Delhi based and I'm taking care of the entire Delhi. My clientele is around Delhi and NCR. You see, I mean, heart failure basically more dependent on the symptoms. As such, nobody can predict or nobody can diagnose from the outside. It is the patient only who will tell you. It's all depend upon the symptoms. So those can be related to the various issues. Can be related to the latest, fresh heart attack, which we see in our medical term, myocardial infarction. It can be related to the stress. It can be chemical related some, reactions, or it can be, the sepsis, or it can be related to the some comorbid conditions also, like person is having underlying diabetes, hypertension. So they may have such kind of symptoms. Symptoms can vary from person to person, which include mainly shortness of breath, then pedal edema, which we say swelling in the feet, then sometimes you may have swelling in the face also. But shortness of breath is the first symptom which patient recognizes and which he tells to the doctor. And if you talk about the incidence of heart failure, as such, it is very common particularly in our region, especially in India. So Asians are very prone because most of the time they ignore their problems, they ignore their symptoms. They do not recognize. The moment they reach to the hospital, they are already into the stage 3 or stage 4 stage of the heart failure. So it is very common in India. You see, as I have already told you, the one who has recently, experienced a myocardial infarction, he is the one who can get it very early. Those who are having underlying systemic hypertension as well as diabetes, they are also the suitable candidate for the heart failure. Apart from this, any bacterial or bacterial infection or any sepsis, that can also lead to the heart failure. Yeah, I mean, you see, the moment any patient, if he notices any shortness of breath or any swelling around the face or as well as in the legs, so I mean, he should ideally consult with the doctor and should undergo series of investigations. So there are, I mean, 2, 3 basic principles for this to diagnose it. First of all, clinically we can judge it, and later on by the help of laboratory investigations, we can label it. One is echocardiography, by which we can surely label it whether patient is having systolic or diastolic heart failure. Secondly, the other lab test, which is called NT-proBNP. So that is also very common, I mean, here in our region. So by performing all these tests, we can find it out. No doubt, I mean, the symptoms and complaints will be the first one to report it. It can be treated with the help of, first of all, with the help of medicines only. That depends in which stage patient is coming to. Suppose if the patient is landing in the emergency, so definitely, I mean, you have to go very, very cautiously and very, aggressive way to treat it with the help of, IV diuretics, intravenous diuretics, and later on you can shift into the medicines. If we talk about the medicines long ago, I mean, from the Egyptian times, we are seeing all such patients, and there are every time there is a change in medical pharmacotherapy side. So starting from the diuretics, nowadays we are getting very good medicine for this heart failure. So latest is the example of the RE, with which nowadays I am recommending at least to my patients, and I am getting very good results. You see, my message is this: first of all, we need to improve the quality of life. So that is the foremost aim for any patient who is suffering from the heart. Suppose if we overcome the quality of life, then definitely the life becomes very easy and simple. So first, the point is this: you have to take precautions. There are certain precautions which you have along with the medicines. Suppose the patient is having diastolic failure along with the ejection fraction of 20 or 25%, then it is obvious that he has to take care of the drinking intake throughout 24 hours. He can only have either maximum 1.25 liters per day, along with the mixing of all the medications, his food and tea, and then milk and everything. So one precaution that he has to take, because your already lungs and your heart is compromised. So in that condition, it is foremost, the sign which he has to take care of. Secondly, medications, no doubt he has to take promptly, and he has to take regularly to avoid such symptoms. Thirdly, the visit, that is more important. He or she will have to visit with the doctor regularly. They will have to show in a regular interval to the doctor, so that their assessments can be made accordingly, and if required, the further tests can be carried out depending upon the condition. So the take home message is this: you have to improve your quality of life. Once quality of life will improve, definitely your symptoms will improve, and there will be less hospitalized admission to the hospital, and there will be less visits to your clinicians. So this is the difference. Yeah, there are a number of ways by which you can make your heart stronger. First of all, you need to, overcome of your stress, which is the biggest factor. And definitely, you have to, maintain a good, healthy lifestyle. And thirdly, you need to choose a good food regime for you. And fourthly, suppose if you are underlying having any comorbid conditions like diabetes, hypertension, or any other conditions, for that matter, CBA. So in that condition, you have to be, genuine and generous with your medications. So you can't take it, lightly.